podcast where we talk about the world's most advanced diagnostics, techniques, and innovative treatments for cognitive disorders. Each episode will bring the latest news and information about how we can potentially help the more than 55 million people worldwide affected by cognitive impairment. And that number is forecasted to grow to 150 million by 2050. I'm Tom Dent, Executive Chairman of Recognition Health. In 2011, Dr. McSweeney and I saw this growing health crisis, and we wanted to be a part of the solution. We believed we could assemble professionals, processes, and strategies to provide a specific diagnosis and then provide the newest treatment and care for people with cognitive impairment in the United Kingdom, the United States, and beyond. Dr. Steve Addler, a consultant neurologist at Recognition Health and a real trailblazer in the evolving landscape of brain health. With over 2 decades of experience, he's highly recognized for his experience across the full spectrum of neurological disorders, including dementia, migraine, neurological pain, traumatic brain injury, known as TBI, and functional neurological disorders. Steve, I have been so looking forward to this podcast because I always enjoy your insights and just the way you present those. And before we go further, I want to congratulate you on your TED Talk on dementia. And those of you who have not seen it, I really encourage you to watch it. It's fascinating. And Steve, this is where we're going to pick up, and we're going to jump right into it. We'd love to have you share some of your findings about dementia. And maybe to start, in your TED Talk, you said something dramatic. You said, if we live to be 100 years old, likely half of us will have some form of dementia. But we're also told dementia is not just a disease where the brain cells die because we get old. So is there hope for us, and how should we be thinking about this?
So I think there definitely is hope, but that TED Talk was part of a section on longevity. And as soon as I was asked to give the talk, what came to my mind was everybody's trying to live longer, which is understandable. But there is the uncomfortable truth at the moment. If you do live longer and you get to 100, there's a 50% chance you'll also have dementia, which I don't think really is the point of living longer.
Yeah, so oftentimes we simplify dementia by thinking about Alzheimer's, but is really the term dementia describing more than just one single condition? And so how should we be thinking about that use of the term dementia, and is it broader or different than Alzheimer's?
Well, that's a great question. So dementia really is a clinical problem. So it's a clinical problem where people's thinking, particularly their memory, slowly starts to get worse, and you can't find any other cause of that than you, at the moment, imagine that the brain cells are dying away slowly, which is kind of why you're presenting like that. Now, most cases in people who are older are still Alzheimer's disease, but when you get into the brain of people and look at it after they've died, you can see 260 different combinations of abnormal proteins. So it's the most complicated single entity I've come across in a long time.
Well, so in your TED Talk, and I want to go there now because you said there were kind of 3 things you had learned or discovered. And I just want to go through each one of them because each one of them, I think, brings us more information and greater insight. So let's start. What was the first one? And then we're going to move to the second and the third. So what was the first discovery that you talked about?
So I talked about the discovery of something called the glymphatic system. So, and the reason why this resonated so much for me was that it was really discovered and brought to the world in, say, 2012 by a female Danish neuroscientist. But interestingly, so let's 15 years earlier almost, I've been working with a neuropathologist who'd mentioned the possibility of something that then got called the glymphatic system. And I remember him telling me that and thinking, that's crazy. But at the same time, the way he described it, it made perfect sense. And furthermore, I'd even tried to do a research project looking at it, which eventually we just couldn't quite get over the line. But I never, ever forgot the idea of the glymphatic system.
So,
And the
so
reason-
I'm going to interrupt you just
Yeah.
right there, because that's a word. It's a big word. I have no idea what it means, and I
Yeah.
expect most people don't. So I'm going to back you up and say, give us a little definition of what glymphatic means and what the system is.
We've known for a long time that every organ in the body has a lymphatic system. And that sounds like a long word, but really it's just a waste disposal system, because every organ is a living thing. It produces waste products, and the lymphatic system just drains that away. And up until really 2010, a lot of people believe the brain just did not have a waste disposal system, which, when you think about it, doesn't really make very much sense. And the glymphatic system, which was introduced in about 2012, changed all of that. Now, the thing that's interesting about the brain compared to every other bit of the body is it's unbelievably tightly packed. So one of the problems was, if you just put a bit of fluid into the brain, it doesn't diffuse out to the edges, which is what typically happens if you put some fluid into a liver, for example. So this was the clever thing that was discovered, is that in order to get tissue out of the cells in the brain, you needed a pressure gradient. And the way that that was designed by Mother Nature was that it used the arteries surrounding the brain, and they literally pushed fluid into the veins, and then the veins would go out. But in order for that to work, because you're using the brain all the time, it makes sense that the cleaning system happens at night when you're asleep. So you're not using your brain normally, so it can focus on cleaning. But then this was the other amazing thing, is the brain literally shrinks by almost 50% to create more space. And then the normal fluid, which is circulating the brain, literally gets gushed through the tissues of the brain to help to help the process. And so this is why brainwashing at night and the pictures were so striking. And it's just so clever. And the final piece is that in order for it to work best, because even though there is a pressure gradient between arteries and veins, it's still not a huge pressure gradient. This is why it's so important to sleep on your side with your head down, because then the pressure gradient doesn't also have to fight gravity. And then when you understand that, that's why going on a plane overnight is so awful, because it's really difficult to sleep. But even if you do get to sleep, unless you're lucky enough to be in first class or business class and you've got a nice normal bed, you're sleeping in a chair and you're fighting gravity. So the combination of those two things is why jet lag and overnight flights are so horrendous. And it does feel that horrendous. And that's literally because your brain is full of waste.
So I think that's the reason you talk about the importance of sleep, and not just sleep, but the position of your sleep. I found that fascinating. Can you just add to that a little bit?
Yeah, I mean, so I knew from personal experience how horrible sleep deprivation is. So we all have had periods where you have jet lag, but as a junior doctor, you have it for days and weeks. And it was obvious to me that you would, in the morning, after you'd gone to sleep, the world looked sharp again. But you do just foggy. And I could never understand what this was. Now, when the glymphatic system was really brought to life, the other thing that they showed was that the glymphatic system is active in different phases of sleep. And so you can't clear your brain of the waste without sleep and the switching on of this glymphatic system.
Well, it's a wake-up call to all those who don't sleep well at night. It sounds to me like it's fundamental to brain health and maintaining a very healthy brain. And then the second thing I think you said you had really discovered had to do with neuroinflammation. So what do we need to know about neuroinflammation? How's that related, to this whole sleep, night, brainwashing concept that you just described?
Yeah, so I think probably stepping back is, and certainly this is true of myself as a neurologist, is we tend to get obsessed with like the nerve cells that do all the thinking, feeling, etc. And we don't pay as much attention to the support, what's called the other brain, which are these cells that allow the clever bit of the brain to exist and work and keep it going. And one part of that other brain are these microglial cells, and so the rest of the body has got an immune system, and this is the brain's immune system, and it's there and it's fantastic and it's clever. But this is the twist: is it's clear that it can only do so much. And what's common in a lot of conditions that affect the brain, what seems to get it going and maintain it is that you keep stressing the brain. And these microglial cells, which I termed in the TED talk the housekeepers, they're desperately trying to clean everything up. But if you stress them, they sort of go on strike. And they don't just kind of put down the tools. As I said, they start smashing at the room, so the cells flip and they start damaging the cells that they're meant to protect as well. And so in dementia, you have all of this buildup of the protein, but the thing that seems to trigger the brain cells dying rapidly, which is what we see clinically with dementia, is that this inflammation is just feeding on itself. So recognizing they're there and understanding how they function will be the next frontier of brain medicine, in my opinion.
Well, it sounds frightening for all of us as we think about it and try to comprehend what's going on, inside our brains. So come back and link that all now to dementia and or Alzheimer's. We've talked about the neuroinflammation before that, the importance of that sort of cleaning function that goes on. So why do some of us end up with dementia, others don't? How do we maintain, or do we know how to maintain a healthy cleaning function in our brain? What can you inform us about that?
Well, I mean, I think so again, when I think about that conversation I had in 97, he casually said to me, oh yeah, this system takes amyloid out of the brain. So I'd never, so we know Alzheimer's disease, and we know one of the characteristics is it's got all this amyloid. But I'd never thought, well, but amyloid's just a normal bit of the brain. And our brains normally need it. And of course, you have to turn it over day in, day out. And all that happens in Alzheimer's and dementia is these waste products of the brain just start clogging up because you can't clean them out for one simple reason. We've overwhelmed our the support systems in the brain. And that is a completely different way of making sense of what dementia actually is. So the nerve cells, if all the support structures were working well, they wouldn't wear out. We wouldn't get dementia because of those at 100. It's because we overwhelm the support structures, and that starts as early as you like. So look at I know it's controversial in America because you guys love American football, but there's no doubt about it that if you keep bashing your head as a teenager and you're unlucky, that is stressing these support structures in the brain. And it's that stress on the support structure that can lead to people getting dementia of a different type to Alzheimer's really early. So I think we've actually kind of
Yeah.
got this example. So it turns dementia into something where we all have ownership. So we just need to think from as young as possible. Every night, my brain is trying to clean itself up. Am I helping or hindering that process? Every time I subject my brain to physical injury, I'm stressing the support structure of the brain. And if you keep doing that, then it's only got so much resilience.
So really, that's the third, I think, point that you wanted to make or did make in your TED Talk, and that is that very early discovery and detection is so important. And I want to come back to that in just a moment. But you said something a moment ago about your brain renewing or refreshing itself. And so I think I recall maybe in your TED Talk, you did speak to the fact that your brain, like I guess other cells, is renewing itself. Can you just speak to that just a moment? Because I was actually not really aware of that.
Yeah, I mean, we experience ourselves as like a consistent person, but actually underneath, in every part of us, the cells are turning over again and again, and it's no different in the brain. And because the brain is so active and is learning all the time, the turnover is quicker than most other tissues. And so I said in the TED Talk, you turn over 5% of the structures in your brain every single day.
So every month we've got basically a renewed brain.
Yeah,
Is that fair to say?
yeah.
Yeah. Yeah. So, Steve, obviously we know that any kind of head trauma continuously or singly can be damaging. We know from what you said, sleep is so vital. We also know all the other normal things we try to do to maintain good health is important. But is it as clear as if you do these 5 or 10 things or don't do these 5 or 10 things, you'll never get dementia? Or is there still a mystery around that?
Yeah, of course. I mean, so there's no doubt about it that in terms of the simple things that you can do to kind of make sure that you reduce your risk. So obviously, and this is something that is a bit counterintuitive, is why is sleep so important? So sleeping well is clearly important. But then you can literally go through the systems of the body. So making sure your heart works, make sure your lungs, then you're stressing those appropriately with exercise. The way that the microbiome in the bowel talks to the cells in the brain is becoming clearer and clearer. So making sure you have the right amount of diet, making sure that you're not exposing yourself to ultra processed foods. All of these things link back to dementia. And so as I was kind of preparing this talk, the relationship of air pollution to dementia became clearer. So people can now actually take the particles and track them all the way through the body into the brain, and how that then puts more stress on the support structure around the cells in the brain. So hopefully what it does is it kind of changes everybody's view. It certainly has changed my view, which is I started off thinking dementia was a disease primarily of the nerve cells. But it's not. The nerve cells are fine. It's a disease of an overstressed support system.
Yeah. So as we kind of come to the latter part of this time, because I know you're busy and you've been, as always, we could talk for an hour or two about this. But I want to come back to the fact that this disease, this damage, starts occurring quite young in life, in midlife, if you will, or even before that, where there's no symptoms and we're not aware of it. So how soon or how should we go about testing ourselves, or how frequently, should we be thinking about this, testing for this? What would you say to the average person out here that's, in their 40s, 50s, 60s? What do they need to be doing right now?
Well, well, like all of medicine, I always think of medicine as trying to build a plane as you're flying it. I mean, that's what it's like in reality. And now that finding, which is the third big finding I talked about in my talk, is unbelievable. that you can see people at 50 who've got zero symptoms, yet their brain is totally full of amyloid protein. And these are not just outliers. There's a lot of people in that situation. So now that amyloid didn't just turn up overnight. That's been building up for decades. So it really does start to put the genesis of this problem back into kind of 20s, 30s, 40s. So now, in terms of what we can at the moment test that allows you as an individual person, you and I, to predict, how likely are we to do that? We're not quite there yet. So to everybody listening, you just have to take it on a leap of faith, sleep well, exercise well, eat well. But there's so much interest in this, and the drugs and the trials are starting to now test people who've got no symptoms at all. They're just getting into trials on the basis of this type of scan. There's going to be a huge explosion in this area. And this is why sort of Recognition is such an interesting organization, because we are literally at the forefront of this new frontier. And we can see that we're doing work and delivering drugs in people with dementia right now. We're also doing trials of people who haven't got symptoms, who are at risk. And we're now going to open up this whole field of how to help people navigate earlier and earlier in their lives. I think at the moment, what is available is really, really difficult to navigate, which is why you need a trusted source. And I can see that we're going to have a major role of being a trusted source in this space.
Yeah, I really like that phrase, because Recognition Health is, in fact, a trusted source, and Recognition Health and all the patients and customers that Recognition sees is so fortunate to have you a part of that company and all the research that's going on and the forward thinking that's occurring. So as you would close, is there one message you would give to anybody who may be slightly concerned that they're just not quite as sharp or their memory's not quite as good? What would you say to do to that person, and how could Recognition Health be a part of helping them navigate to get to some conclusion?
Yes, I think if you're over 50, reach out to us, speak to us, see what clinical trials we've got, what clinical services we've got that may be helpful. If you're under 50 at the moment, follow us. We'll be putting out more and more information about what is the reliable, what are the reliable tests, what are the reliable suggestions, whether it's sleep, supplements, etc., etc. I know myself, it can be overwhelming trying to navigate all of that, but follow us. We will become a trusted partner on this journey of everybody.
Steve, thank you so much. That's just awesome, and your insights just bring us, as you said, a trusted source of information about all the new discoveries, the current activity, the treatments for cognitive disease. You are a treasured professional and a great friend. Thank you for spending time with us this morning.
It's a great pleasure, Tom.
That was Dr. Steve Addler, a consultant neurologist at Recognition Health and a real trailblazer in the evolving landscape of brain health. With over 2 decades of experience, He's highly recognized for his experience across the full spectrum of neurological disorders, including dementia, migraine, neurological pain, traumatic brain injury, known as TBI, and functional neurological disorders. He leads advanced clinical and medical legal services spanning civilian, military, and sports-related neurological injury. And he's at the forefront of integrating neuroscience, psychiatry, and technology to deliver better outcomes. Thanks for joining the Brain and Mind Experts, the podcast where we talk about the world's most advanced diagnostics, techniques, and innovative treatments for cognitive disorders. Each episode will bring the latest news and information about how we can potentially help the more than 55 million people worldwide affected by cognitive impairment, and that number is forecasted to grow to 150 million by 2050.